Hi, my name is Kimberlina Vargas. Today we'll be discussing a disease that affects nearly 4 million people all over the world. It does not discriminate against geographical location, age, nor race. However, it is gender biased because only people with a vaginal biome can get this disease. Today we'll be discussing bacterial vaginosis. Typically, the female gender who is born with an intact vagina will experience bacterial vaginosis at least once in their lifetime. This disease is so prevalent because the microbiome of the interior of the vagina is so sensitive that it is susceptible to change with the slightest influence or disturbance, throwing off the balance of the good and bad bacterial ratio. Just like the lining in our gut that helps with metabolic functions, the vaginal canal is coated with over 350 different bacteria species. Some are more prevalent than others. These bacteria create an acidic environment that's specific to each individual. When a new bacteria is introduced, either through sex, douching, etc., it causes an imbalance. Even certain antibiotics can cause the good bacteria to die. The pH balance will then be thrown off and become either too acidic or too basic, allowing a certain bacteria to dominate the biome. Typically, healthy vaginal mucus will consist of 95% lactobacillus, which is a healthy bacteria. Although Gardnerella vaginalis is a bacteria that is found in a healthy vaginal biome, too much of it will cause bacterial vaginosis. Bacterial vaginosis is considered a sexually transmitted disease because a sexual partner can throw off the bacterial biome of their partner. However, in each circumstance, it is treatable and not life-threatening. Typical symptoms are foul-smelling odor, unusual discharge such as a green, white, or grayish color, a cottage cheese-like substance, pelvic inflammation, and many may not experience any symptoms at all. Diagnosis of bacterial vaginosis is done in a clinical setting by either a family doctor or gynecologist. A vaginal swab is taken from the discharge or cervical region of the vagina. Then it is placed on a wet mount for review under a microscope. If the cells on the wet mount are conclusive to an overgrowth of a certain bacteria, that is a positive confirmation of bacterial vaginosis. Also, one can take the discharge and do a pH test on it, and if the pH of 4.5 or greater is confirmed, that is another way of diagnosing bacterial vaginosis. Another test is a positive whiff test. It is done by taking potassium hydroxide and adding it to the microscope slide, and if a foul odor is released, then it is a sign. If one is experiencing two or more of these, as well as the discharge, then bacterial vaginosis can be confirmed indefinitely. If one of these is only confirmed, then they might have to run different tests because bacterial vaginosis is similar to other diseases, such as yeast infection or other viral infections. Treatment for bacterial vaginosis is typically an antibiotic that can be found over the counter in many pharmacies and drugstores, such as metronidazole, clamidocirracin, and tindazole. No prescription is required and it comes on varying strengths that could be taken once or over a period of a week. Symptoms should subside over the whole course of the medication. Some preventative steps to take would be limiting your sexual partners, not using scented products near your vaginal area that can cause irritation or allergic reaction. For example, certain soaps or certain materials. It is recommended to use cotton underwear and let your vaginal area breathe during the night. This prevents moisture to accumulate. One can also take probiotics orally, such as lactobacillus probiotic in a pill form, as well as eating foods that have natural probiotics such as kimchi, yogurt, and kombucha. Another form of treatment is self care, when one is consuming lots of water, being hygienic, and taking baths frequently, and making sure that your clothes are always clean can prevent bacterial vaginosis. Washing your sheets frequently and not sharing washcloths, and frequently washing your towels that are used in that area. Another would be correctly cleaning that area after having any bowel movements, such as wiping front to back and never back to front. That will cross contaminate the bacteria from the rectum to the vaginal canal. Also, maintaining a healthy diet. Eating cranberries can flush out the bacteria in our bodies. And just like the image above says, kale can boost your immunity, garlic is an antifungal, lemon can restore your body's pH, and I mentioned before the probiotic yogurt. It is not necessary to take an antibiotic to treat bacterial vaginosis. One can treat it on their own by incorporating these good habits and allowing your body naturally to fight it off. Bacterial vaginosis is a very personal disease. It's different in everybody and is treated differently for everybody. One antibiotic can work for you and one dose, and somebody will experience a whole other approach and have to change. But definitely prevention and being self-aware of your body's needs is number one way to combat bacterial vaginosis. Just taking care of ourselves physically, holistically, mentally, all the ways that can be incorporated in order to maintain your body's good bacteria health. Thank you for your time, and I hope you learned a little bit more about bacterial vaginosis, and have an open discussion with people you may know so that you can share information and help someone who is also struggling with recurring bacterial vaginosis.